Hey everyone, my name is Caitlin and today we're going to be going over gambling disorder. So a little bit of an introduction. The DSM-5 criteria states that gambling disorder involves persistent maladaptive gambling behavior that interferes with personal, family, or vocational pursuits. So 4 or more of the following symptoms occurring at any time within a 12-month period is required for a diagnosis. Need to gamble with increasing amounts of money, and this is in order to achieve the desired excitement. Second criteria is restlessness or irritability when attempting to cut down or stop gambling. Third, has made repeated unsuccessful efforts to control, cut back, or stop gambling. Fourth is they are often preoccupied with gambling, for example, having persistent thoughts of reliving past gambling experiences, handicapping or planning the next venture, or thinking of ways to get money so they can go and gamble. 5, often gambles when feeling distressed, for example, feeling helpless, guilty, anxious, or depressed. Sometimes feeling the need to gamble comes from that, so they feel a little bit better. Number 6, after losing money gambling, they often return another day to quote unquote get even or chase their loss or try and win back their money. Number 7, they often lie to conceal the extent of their involvement with gambling, especially with close relationships, friends, family, things like that. Number 8, they have jeopardized or lost a significant relationship, job, or education or career opportunity because of gambling. And finally, they rely on others to provide money, especially to relieve some desperate financial situations caused by gambling. So the course and prevalence. Onset usually occurs during adolescence or young adulthood, but in some cases, people may develop the disorder during middle or even late adulthood. It just kind of varies by person. This is a pretty variable diagnosis to give. Second, there tends to be a progression, so both in frequency and wagers. So frequency often increases over time, and wagers such as money, time, etc. tend to increase over time as well. Like I said, gambling is a highly individualized disorder, so some people may be able to wager thousands of dollars and not have the disorder, while others may buy lottery tickets and have the disorder. It's really individualized, and it's important to go by the DSM-5 criteria in order to diagnose it. Next, there's no definite pattern of gambling. Gambling can be regular, for example, buying lottery tickets every day, or irregular behaviors, for example, sometimes going to slot machines, but not being able to leave for extended periods of time in order to chase those losses, or seeking the thrill, things like that. And lastly, gambling tends to be more common among males rather than females. What's interesting is that females are actually more likely to suffer from depressive, bipolar, and anxiety disorders in combination with gambling disorder. And that early gambling disorders likely start due to interactions with friends or family. So the prognosis. Individuals are likely to resolve their problems with gambling disorder over time, especially if their issues start earlier on. However, other risk factors associated with the disorder may make this difficult. Things such as past gambling problems, family history of gambling, and being in close proximity or around a lot of people who have the disorder. Some functional consequences of gambling disorder include the obvious kind of loss of relationships, jobs, financial strain, and actually poor health. So some cultural considerations. Specific cultures and races may participate in specific types of gambling compared to others. According to the DSM-5, indigenous populations and African Americans tend to have higher prevalence rates of gambling disorder compared to European Americans, and Hispanic Americans tend to show similar rates to European Americans. In a study from 2004, the authors suggest that cultural variables such as beliefs, values, and attitudes may contribute to both initiating and maintaining gambling behavior. Discouraging versus encouraging gambling behaviors, as well as risk-taking in specific cultures, especially contribute to the development of problem gambling. Next, we're going to do a little review of the literature and go through some screening and assessments, as well as differential diagnoses. So some screening and assessment tools. The following is just a short list of approved gambling screening and assessments. There are many more, and there's a link in the outline provided for this lecture for you to go and look at. I'm just going to go over these 4 really quickly. The Labet Tool is a questionnaire that has 2 items. If the individual answers yes to one or both of those items, further assessment for gambling disorder is needed. The tool is often used as a precursor to others in order to rule out gambling disorder rather than to diagnose. The DSM-5 screen for pathological gambling is a 9-item yes or no questionnaire coming directly from the American Psychological Association and is found to be valid and reliable in the assessment of gambling disorder. An answer to yes to 4 or more of the items indicates a diagnosis for gambling disorder, and less than 4 indicates a potential problem which should be further explored. The Problem Gambling Severity Index is a tool used as a part of the screening process to determine the severity of a patient's behavior, specifically related to problem gambling. And the South Oaks Gambling Screen is comprised of 16 items and places individuals into 3 categories, either non-problem, problem gambling, or pathological gambling. And the screening tool has also been revised for adolescent screens, as well as it is available in Spanish. Next, we're going to go over some differential diagnoses, specifically the ones that are listed in the DSM-5. Oh, I'm sorry. One second. This is an example of the Labet Tool. So there's 2 questions, yes or no, and it's pretty simple right here. And then the DSM-5 pathological gambling diagnostic form is pictured here. So some differential diagnoses. Non-disordered gambling is often a differential diagnosis. However, compared to gambling disorder, non-disordered gambling may be professional or social in nature, so you might hear of professional gamblers in Vegas who are at a convention or are having a competition or something like that. And social gambling, so things like just getting together with your friends and having a poker night, something like that. So in these instances, risks are limited and gambling behavior is limited to these social gatherings where there are more acceptable, non-detrimental losses. A manic episode may also be a differential diagnosis, but in this case, gambling behaviors may occur during a manic episode. So what distinguishes the 2 is the continuation of detrimental gambling behaviors past a manic episode. So if gambling stops as a manic episode ceases, it's likely that gambling is a part of the manic disorder. Third, personality disorders. A lot of people with personality disorders often can have issues with gambling, so in many cases, both may be diagnosed. But if gambling behavior persists and there's no indication or sufficient symptoms for a personality disorder, gambling disorder is a likely diagnosis. Finally, due to other medical conditions, gambling disorder may be a result of those, so it is important to rule out other medical conditions and medical factors when making a gambling disorder diagnosis. So, some treatments. We're going to go over pharmacological treatments first. There's currently no approved drug for the specific treatment of gambling disorder, but there is a relationship between gambling disorder and other disorders such as obsessive compulsive and addiction, and these have been grounds for some pharmacological testing for gambling disorder. So far, opioid antagonists seem to have the most research backing significant positive effects on gambling disorder. Naltrexone is the most researched and accepted as a treatment to reduce gambling disorder severity, and this is actually legal in Australia. So next is some psychological treatments. The first is motivational interviewing. This is where you empower patients to identify and attempt to solve their ambivalence towards change, as well as having individuals analyze their behavior by comparing their specific gambling patterns to that of the general population. Second is cognitive behavioral therapy. This is especially effective regarding behavioral addictions, and it stresses including motivational components as well as cognitive restructuring. And it aims to get the patient to understand their distortions and irrational beliefs related to gambling, as well as any magical thinking that might occur with this disorder. So in combination with CBT, mindfulness is a common and effective co-treatment for the disorder. And finally, support groups such as Gamblers Anonymous provide a safe space and support system for those to share and keep on track to recovery. So next we're going to go over a brief vignette just to give you kind of an example of gambling disorder. So here's the example. A 21-year-old male is referred by his family for evaluation of his gambling problems. He frequently visits casinos as well as participates in volatile online gambling and cryptocurrency at least 6 hours per day. In the last year, he has lost about $50,000 and is increasing bets as time goes on to get a quote-unquote rush. He works a minimum wage job and often asks friends and family for funds, which facilitates his behavior. The total debt he owes to others is about $25,000. He has since lost interest and motivation in his work and social relationships, spending most of his time focusing on gambling and trying to quote-unquote win big. Just quickly, some of the symptoms that we see here are the need to gamble with increasing amounts, increasing his bets as time goes on, has persistent thoughts related to gambling, that can be seen as in his loss of relationships, which is another symptom or diagnostic criteria is the loss of close relationships. Even after losing money, he continues gambling in order to win big. He has lost at least $50,000 and continues to gamble. As I said earlier, he is jeopardizing losing his job. He has little interest and motivation in his work and social relationships. And finally, he often relies on others to provide money in order for him to continue his behavior. And just some cultural or demographic things. He is in the age range of a young adult, a male, who is more likely to be diagnosed with this disorder as well. And given that he is 21, it's safe to say that he began quite early on. So that's going to be the end of this presentation. I just put some helpful numbers and links in here for anyone who might be struggling or might need these in the future. So the National Problem Gambling Helpline is listed, as well as the Substance Abuse and Mental Health Services Administration's helpline, and the Gamblers Anonymous website, which you can look on to find a local club near you or your patient. Anyways, thanks for listening. I hope this was informative, and I'll see you